Virtual humans in Japanese education, public events, and health communication. In Japan, the integration of virtual humans, encompassing avatars, AI agents, and robotic interfaces, has become increasingly prominent in sectors such as education, mental health, and crisis communication. This expansion reflects a broader cultural and technological embrace of virtual interactivity, combining Japan's advanced digital infrastructure with social values that facilitate the adoption of human-like digital entities in both formal and informal roles. This paper surveys the deployment of avatars in pedagogy, health outreach, and public information delivery, tracing their functional and cultural evolution across these key domains. In educational contexts, virtual humans are widely used to enhance learning environments, support remote participation, and reduce anxiety associated with traditional classroom settings. One prominent example is the virtual transfer student application, which places an avatar in classroom discussions to act as a devil's advocate. This promotes critical thinking by encouraging students to engage with diverse viewpoints, particularly in settings where conformity is culturally valued. To address the issue of absenteeism, avatar robots are now employed in some Japanese classrooms, allowing students who are unable to attend in person to participate in lessons remotely. These avatars serve not only as communication proxies but also as social bridges, helping reintegrate long-absent students. Language instruction has also benefited from avatar deployment. Virtual settings have proven effective in reducing the speaking anxiety of students, allowing them to practice conversational skills in lower-stress environments. In higher education, Japanese universities are experimenting with VR-based immersive learning, such as using simulated photo tours to teach foreign languages in contextually rich scenarios. These efforts are increasingly supported by AI-driven avatars capable of adapting to individual learning styles and providing personalized feedback, thereby optimizing student engagement and outcomes. In the domain of mental health, Japan is exploring the use of avatars to augment counseling services, provide emotional support, and reduce social stigma associated with psychological help. Research from Keio University and the University of Tokyo indicates that avatars can play a transformative role in school-based health consultations, making support more approachable and less intimidating for students. Additionally, social avatar platforms like Zip2 and Pig Party have demonstrated higher rates of online social support and relationship stability compared to traditional text-based platforms. AI companions with emotionally intelligent behavior, such as those offered by otherhalf.ai, offer users a safe and non-judgmental space for expression, particularly valuable in a culture where emotional restraint is often expected. Emotional robotics also play a significant role. Devices like Pepper and Palaro provide companionship and social interaction for elderly individuals, while therapeutic robots like Paro, a robotic seal, are used in elder care facilities to encourage communication and improve emotional well-being. These systems highlight how virtual and robotic humans are being normalized in everyday therapeutic contexts. Nevertheless, researchers warn of potential challenges such as emotional over-reliance and data privacy issues, underscoring the importance of responsible integration. When it comes to public messaging during crises, Japan's deployment of virtual humans is still developing but shows potential. AI-driven platforms like SpecT Pro are used to synthesize and disseminate information from real-time data sources during natural disasters, although they do not yet incorporate avatar-based public interfaces. VR-based preparedness programs such as those offered by Arbose simulate disaster scenarios to help citizens practice emergency responses, offering immersive training rather than real-time communication. In public health, however, avatars and chatbots have played a more direct role. During the COVID-19 pandemic, Japan launched services like Korowa-kun, a chatbot used to distribute vaccine-related information via messaging platforms. Meanwhile, international examples such as the WHO's SARAH avatar illustrate how virtual humans might be adapted for future public messaging in Japan, offering continuous, human-like guidance during emergencies. While fully embodied avatars have not yet been widely used in Japanese public announcements, current tools suggest the foundation for such an expansion exists. Comparing these domains reveals how virtual humans are designed with domain-specific functions in mind. In education, avatars are crafted to be engaging, relatable, and often gamified to appeal to student users. In healthcare, the design emphasizes realism, empathy, and conversational intelligence to foster trust and emotional resonance. For crisis communication, avatars prioritize authority, clarity, and multilingual delivery to ensure effective message transmission under pressure. These variations reflect the alignment of technical capabilities with contextual user expectations and societal norms. The adoption of virtual humans in Japan is strongly shaped by cultural and technological factors. Shinto-derived beliefs about animism and spiritual presence in non-human entities create a cultural openness to accepting avatars as socially legitimate actors. Practices such as Beibai-Naiku, where users explore alternate identities through avatars, highlight how virtual embodiment allows for psychological and social flexibility within a society that often prizes social conformity. Furthermore, Japan's efforts to harmonize tradition with modernity, evident in virtual influencers who blend historical aesthetics with futuristic platforms, demonstrate a nuanced cultural approach to avatar design and integration. Technological advances in robotics, AI, and virtual platforms have further supported this cultural readiness, with initiatives like Society 5.0 promoting the seamless fusion of digital and physical realms in service of societal needs. Several case studies illustrate these dynamics in action. In education, Japanese universities have introduced virtual student mobility programs to enable international exchange without travel, and interprofessional virtual fieldwork has facilitated collaborative learning across disciplines. In healthcare, projects such as the development of virtual human generative models and telehealth prenatal care during the COVID-19 pandemic reflect the scalability of avatars in delivering personalized and remote services. Public events have also embraced virtual humans, as seen in speculative participatory design projects envisioning their future roles in metaverse societies and in Kyoto's virtual cultural initiatives during the pandemic, which used avatars and immersive media to connect with global audiences. In conclusion, Japan's use of virtual humans in education, healthcare, and public messaging reflects a mature convergence of cultural values and technological innovation. The functional specificity of avatars across these sectors, whether as teaching tools, mental health companions, or crisis communicators, underscores their versatility and potential. As these systems continue to evolve, Japan stands at the forefront of integrating virtual humans into the social fabric, setting a precedent for other technologically advanced societies navigating similar intersections of human needs and digital possibilities.